To start with the report, I must also endorse the good work of the committee. In fact, to me, the report is all about helping us to know the level of implementation of the state of public emergency, so that whatever we would want to say, we'll say it in the right way or the way we are seeing it. This is true. COVID-19, coronavirus is a real thing, whether you accept it or not. The fact of the matter is that this is something true in the whole world. Therefore, it is incumbent on all of us to have a collective responsibility to fight this disease or this virus to go away from us. Otherwise, still now, we are going to suffer. So before that, I'm appealing to all of us here and outside this August House to together fight this pandemic for our own saving of our lives. Going by the report, we have two areas that I would want to talk on the side of government and on our own side, because these two has to work hand in glove to make sure that at least we contain or we fight against it totally. Otherwise, it's a problem. Going by the report, you'll be very disappointed if you go by the report in certain areas where, according to your interviews with the ground personnel that you met, I cannot understand. Like, for example, when you go to this Kerawan, is it Farafenye General Hospital? Excuse me. Now, you said, my other colleague said it, but I just want to protest a little on it, that the committee's observation in Plate 2, there was nobody to take temperatures of visitors as they entered the hospital. That's a crime. And you are the people whom we trust to tell us the truth about this coronavirus. But if you are also very careless and you don't mind much about it, who are we to listen to you and to accept your ideas about this coronavirus? So it becomes confusing. I think the personnel there should be very vigilant to make sure that whosoever is entering inside the center is being, checked. Otherwise, you cannot come out again and tell people this corona is true, something real, when you are not practicing the reality of it. And again, with the interview with ground personnel, is crazy. It says, now let's see here. Like, for example, here, the temperature of everyone at the outpatient department was reported to be taken. Yes, maybe those are people whom they suspect to be maybe people affected or suspected to be contaminated. Well, fine. Those ones, they can be checked. But my problem is coming inside. Visitors, these are visitors, not people we think or they suspect. People coming inside. That's where my worry is. So they should take very great care of that. And again, it says the Infection Prevention Control Unit built for Ebola. You see, Ebola, built for Ebola, has been designated as isolated center. We have to be proactive. Since when this Ebola this coronavirus was announced, I said it here, and I still maintain my stand. It is government that is not taking this thing seriously. Why? Because we are talking, saying all sorts of things. But the committee, if you go by your report, the people that you interviewed, they told you something. My worry is, did you make any findings of those things that they told you? If it is so, then well and good. But if you did not also follow those things that they told you that are in existence, then it means you have failed us. Because we all know nowadays people, I'm sorry to say that, but sometimes it's very hard to get a very straightforward person. I'll be telling this when actually behind it is full of evils. I will say I built this when actually it is not on reality. But you can only know this when you make a follow-up. So I don't know whether those kind of things are, you have stepped in to do so. Like, okay, Kaur, is it Kuntaur Health Center, page 16? Your interview said a lot of porous borders, which unless managed, will make the fight against COVID-19 difficult. So to me, this report is very good. It will help us and any other stakeholder to know what is happening in the Gambia as far as COVID-19 is concerned. And I'll also appeal to you. I don't know whether it's going to be possible to make sure that this report is circulated to all relevant stakeholders to know that this is what we have observed as far as the tour and your trip on this COVID-19 is all about. So that now there will be no person left to say, I did not know or I am not informed. Because information is key. If we want to fight this coronavirus collectively, we have to be open to each other and then let each other to contribute in the fight against coronavirus. Otherwise, we'll just be at the same spot. And may God forbid, somebody said it here yesterday, that in China, another 2 cases different from this. So who knows? This is a reality, and I'll appeal to all of us here as colleagues. Let us go back to our people and tell them the reality. This is something true, and let's not take a joke with it. As we did during our political campaigns for these seats, we went around talking to people, whether you listen, whether they listen to you or not, whether they will vote for you or not, but we all went around to talk whatever we want to say to our people. Now we are here, and this coronavirus is a reality. I'm appealing, let's all go back to our people, sensitize them, tell them. Because otherwise, if we don't do that, tomorrow, if, may God forbid, if it turns the other way around, who is going to vote for you? You'll miss your electorates, or even yourself, you may lose your life. So before that, this is something that all of us should put our hands together and fight for it, fight against it. Government, I will emphasize it. Government must be very serious. Take the bull by its horn. Make sure that regulations that are put in place, make sure that they are fully adhered to. I mean, you cannot be a leader and want to satisfy all. It's not possible. But make sure that whatever is good for your people, please make sure that that stands. As a leader, you should make sure that that thing stands and let them understand why you want to do it for them. Let it not be just unless, lip say. You say it here and then finish it. That will not help. Madam Speaker, from the bottom of my heart, I am appealing to all of us to collectively fight this coronavirus away. If not, it's not good for us. And also, in the report, I've seen like GCCI, is it? Yes, GCCI, what they did, what they have contributed. I know many people contributed towards the fight against this corona. I know many because listening to radios and other philanthropists, like in my constituency, there are, agencies that came in to help my people, like the Center Development Project, the Fonyi Dinding Bantaba Child for the Gambia, FAD, all these agencies came in to help. They brought in the detergents, brought in, soaps, maybe, even food, before this food package is even been seen. So that alone is a sign of what I'm advocating for, collective responsibility. Let's all come together and fight this coronavirus away. Going by the report again, Madam Speaker, there is a portion which is saying something very important. Okay, like here in SO Health Center, it says some rice and cooking oil were available, but there was no money to buy other ingredients. As such, no cooking was taking place to provide meals for patients. Pardon? So, this report is terrifying. If there is no food for patients, what does that mean? Then they're going to die. Of course. If you don't cook for me for days, what do you expect to happen? I will die, of course. There is no living being here without food, you survive. Then you are not living. So that too should be taken very seriously by the government. I don't know who provided this rice and oil, cooking oil, but then if it is a philanthropist, then government should come. If it is government, then still now they have to complement, because you cannot give me food, rice, oil, no ingredient, and we all know you cannot cook oil and rice like that and give it to a human being to eat. That's not practically possible. So we have to look into those things also. And again, like here at Amdalai, Kuntaur Health Center again said, Amdalai, a village near the border, does not have water. Does not have water. The villagers fetch water from villages in Senegal. Border closure would be very excruciating effects on their lives. And even know that, it's risky. We all know Senegal is an infected area. If our people should live here and go into that area, then what are we saying? They must come, they must be affected. So their government should come. There is no water for them, and they cannot stay without water. They have to go and get water somewhere, wherever water is. Because we all know water is life. So, Health Minister, you are the one in charge of our health, our lives. So take note, a village in that area has no water. They cannot stay in the Gambia for days without water. So please take note of that too. And again, people, we should hear again the interview with Panchang. my colleague from Panchang, or all those MPs from Panchang, this is our side. He says, it is difficult to get people to cooperate and wash their hands. So again, your own safety, wash your hand. You said no. What do you want? So there are people we have to, ask ourselves, then why do we rely on? We have our preventive measures, do this, and you are safe from this, you are safe from that. You say, no, you will not do that. And when you are forced to do, you blame government or you blame the forces that are doing that. So that too, we also have to be cooperative in the fight. If we are giving the preventive measures, please let's adhere to that and do it properly, so that the life you save, maybe your own. Gambia is very small to control and to make sure things are stable. If I may quote, people sometimes we joke with realities. If I may quote, during the impasse, though it's out of the topic, but then just to give you a sample, when state of emergency was imposed here, what happened? We all adhere to it. But now, why are we not adhering to this also? For our own safety. We said no. People should understand. It's true, government should come and give us what they've said they will give it to us. They should do that. But now, for example, maybe if government also is not doing what is expected of them, obviously there will be an uprising. Honorable Attorney General, Minister of Justice, I told you here one day that if things are not in the right way, people will uprise. And in that, you'll be the man who is going to be accountable for it. So let's all see how best both the government and people to come together to fight this coronavirus. If we do that, at least we are safe. On that note, I thank you for giving me the floor. I take my seat.
Thank you very much.